The NHS is a much cherished institution across the UK. Yet, it is facing a very real threat to its existence as a public healthcare service available to everyone based on need, not ability to pay. And Scotland is not immune to the privatisation agenda being pursued by Westminster. That agenda is literally threatening the very existence of the NHS as a universal healthcare system, free at the point of use. Although the NHS in Scotland is notionally devolved, the Scottish administration in Edinburgh, itself an executive branch of the English Parliament at Westminster, has little or no wiggle room to fully protect our NHS north of the border. That's because ultimately Scotland's overall budget and resources are controlled by the UK government in England, which can, largely as a result of the internal market bill which followed Brexit, also override the devolution settlement and any decisions made by the Scottish administration in Edinburgh, making it almost impossible for Scotland to take a very different path to the one decided in London. And the path that London is taking is private profit before public health. On a day-to-day basis, funding for the Scottish NHS is linked directly to what the UK government spend on the NHS in England through a complicated formula, which means that the Scottish government cannot spend more on the NHS here without taking money from other spending priorities from an ever-decreasing budget, set and controlled by the government in England. And in England, the NHS is being privatised brick by brick with what many people believe is the ultimate aim of creating a health-for-profit system, just like in the United States, where 25 million people who cannot afford expensive health insurance have absolutely no access to basic healthcare services. There is no doubt that in America, big profits come before the needs of patients. The cartel of health insurance companies literally decide who lives and who dies. In the US, patient dumping is a regular occurrence where unprofitable and vulnerable sick patients are dumped onto the streets in the early hours in order to free up beds for lucrative patients with plenty of money or with plenty of health insurance cover. It's a system many fear is coming soon to Britain, where public healthcare in England is being increasingly put into private hands, where driving profits is more important than your health. In 2019, more of the NHS in England was sold to private firms than ever before. Billions of pounds have been siphoned off from the health budgets to run a profit-driven system. All the changes seen to the way the NHS in England is structured since the early 1990s have been about liberating these public assets for corporate raiders to take them over. To private corporations which spend millions of dollars annually in lobbying Westminster politicians, the NHS represents a £128 billion a year opportunity to make big profits at the expense of healthcare based on need. And although Scotland has, to date, largely been able to resist the march to privatisation, ultimately, the Scottish Government does not have total control over the country's destiny. England, calling itself the UK, does. In 2022-23, the Scottish NHS spent £116 million on private health providers, which is 0.7% of its frontline health budget. By comparison, the UK government in England spent £11.5 billion on external private sector providers. But despite the very real constraints of operating in an environment where the country next door controls your country's revenues, the Scottish NHS has been regularly outperforming the NHS in England. Westminster's privatisation process started in the 1980s during the Thatcher era, but it's been accelerating since the 2012 Health and Social Care Act was passed in London, introducing a network of clinical commissioning groups which are required to put health services out to competitive, mostly private tender. That process has been further accelerated by the 2022 Health and Care Act, which has seen the government in England prioritising the use of private companies over the NHS, sometimes with disastrous consequences. This included the National Test and Trace system during the COVID pandemic, and the awarding of contracts to private firms for personal protective equipment, firms which had little or no experience in providing medical equipment, an exercise which saw nearly £10 billion of public money written off on useless or defective PPE equipment. So what's the problem with privatising public health services? To start with, the first duty of a private company or corporation is to make profit. Profit which in this case comes out of taxpayer funding. In order to drive profit, companies cut the quality of care and the number of qualified staff they employ. Studies show that there is little justification for privatising healthcare, and one study published in the medical journal The Lancet showed that outsourcing care to the private sector has led to increased death rates among patients. According to critics, privatisation undermines the NHS because private providers will always focus on profitable low-risk elective treatments such as hip replacements, leaving the NHS to cope with complex and more expensive services such as A&E and intensive care. Before the system of tendering was introduced in England, NHS providers used any surpluses from one area to support more expensive services provided in another area of the service. But with the more profitable services being contracted out to the private sector, there are no surpluses left for the NHS to use, thus threatening the viability of established NHS providers. What's more, private providers generally rely on the NHS to train doctors and nurses without contributing to the cost of that training whilst drawing the NHS-trained staff into the private sector. Although the current Labour administration says it is not going to create an American-style health system here, something former Conservative governments have also claimed, Labour's current Health Minister Wes Streeting says the door is open to the further involvement of private firms in the NHS, which, say, critics like former MP and NHS surgeon Philippa Whitford, is undermining the NHS as more resources are drawn away from it.
Well, I spent 33 years in healthcare in the NHS, predominantly a short time overseas in Gaza. Breast cancer was always my special interest in my research and generally what I was focused on. But I did also do general surgery and trauma. I spent 19 years at Crosshouse Hospital in Kilmarnock as a consultant doing general surgery and breast cancer.
So what led to Dr. Whitford becoming an MP after leaving the NHS?
Well, I was very active in the independence referendum, and what actually led me to that was the shock of seeing what they were doing to the NHS in England. I started following in 2011 and couldn't believe that anyone thought it was a good idea to fragment the NHS in England into competing hospital trusts that aren't just bidding against private providers, they're bidding against each other. And what we've certainly seen over the last decade is that cause basically, competition instead of cooperation. It has broken and fragmented the NHS in England. And so I was following this for quite a long time. And then when we got to the independence campaign, I realized people here in Scotland had no idea what was happening south of the border. So that was very much what got me on my hind legs, got me travelling around, because in the long term, that could threaten the NHS in Scotland. Of course, after the referendum, I had people going, oh, you should stand, you should go to Westminster, and me going, you must be completely off your head. I had no intention of doing that, but I had 2 months of people nipping my ear, telling me to go to Westminster, including the late Alex Salmond, who tried to talk me into it. He also didn't succeed. But I had been very active with Women for Independence, and their strapline was Independence for Women. And along with Jean Freeman, I hosted an event here in Troon for over 200 women, trying to get women to step up and step into politics. And it obviously worked on me, because when I woke up the next morning, I thought, I'm going to have to do this. If not me, who? And that's really why I stood. And then you're so busy fighting a campaign, it's only when you wake up on the green benches. And I remember my husband texting me at the state opening of Parliament going, are you okay? You're really pale. And I just replied, OMG, what have I done? Because it was just a total shock from going from such a useful, productive job to thinking, what on earth can I do at Westminster? Well, the thing is, most people think that the Scottish Government controls everything about health and the healthcare system in Scotland, and that isn't true. We didn't vote for Brexit, which has added to what is probably the biggest challenge for all four health services, which is workforce. We don't control professional registration. We don't control drug licensing. But the most important thing is that it is still Westminster which sets Scotland's budget. And the problem is, while they don't control how much that budget goes to health, they control the overall purse. And that is a serious problem for Scotland. It's actually a bigger problem now than it was in 2014 because of the Internal Market Act. Wes Streeting, who is determined, as he says himself, to hold the door open for private companies and have more private engagement in the NHS in England, has power through the Internal Market Act to actually force some of these policies on Scotland. So they control the purse strings, but they now have also a more direct method. But the other thing that people need to realise is, I get asked to talk about the NHS all the time, but it's not right to call it a national health service. It's actually a national illness service. We spend our time catching you when you fall, picking up the pieces, trying to help you manage illness. If we're lucky, we might even cure you. But that's not what gives you health. Health is something that is given to you in the early years. If you get to grow up with enough food in a warm, dry house, in a stable family, in a nice community, these are the things that give somebody health. And poverty and deprivation are the biggest drivers of ill health. And a lot of poverty is driven by Westminster austerity. And we've seen that over the last 14 years. The fall in life expectancy, the lives lost to austerity. And the Scottish Government have no power over that whatsoever. And that's the reason why more of us talk now about things like a well-being economy, instead of sacrificing people on an altar of GDP and growth, regardless of their well-being, and therefore having poverty wages, insecure jobs. It's not enough to just try and mitigate that with benefits or patch it up with a health service. What we actually want to have is an economy that respects people and planet in the first place. And that's something the Scottish Government have been pushing for since 2018. But if you don't control the levers of that economy, you can't deal with the underlying problems that keep driving Scots into ill health and suffering, and then the NHS is trying to pick up the pieces.
So whilst the Scottish Government wants to create a more holistic approach to health, including a well-being economy, in England, Westminster wants to create a more commercial system where greater parts of the NHS are run by private firms responsible primarily to their shareholders rather than patients.
I think that what we're seeing in England after the Lansley reform changes came in 2013 is just the huge impact. We saw that by hook or by crook, the NHS used to balance its books by finding a few pounds down the back of the sofa every year. But from 2013 onwards, it started to get into debt. And that reached about 5 billion quite quickly, which then meant trusts were under pressure to make cuts, to close A&E services, to make staff redundant, to close wards, all of which decreased the bed status in England and the capacity. And what you see is things like A&E performance in England suddenly going downhill from 2013, where other health services, particularly in Scotland, it was the later teens and particularly the pandemic that drove down performance. But in England, that was already built in. And as we've seen the deterioration, is you see more people being driven to private healthcare out of desperation, either by taking insurance, using insurance, or even paying out of pocket. And that then does actually affect what is the official health funding in England and does affect the Barnett consequential to Scotland. What we hear talked about from the Institute of Economic Affairs, Nigel Farage, if God help all of us, he ever became a future Prime Minister, is very much this eye on an insurance-based system. What Wes Streeting is talking about is not yet that, but he has clearly said he wants more private companies in the NHS. And what we've already seen in the last decade is how that fragments the system in England. You have increased administrative costs because you have a healthcare market. You are buying and selling. It doesn't actually make any sense. You're better to take the public funding, work out the population that you're looking after, and deliver healthcare without buying and selling different aspects between groups, and therefore having these ridiculous administration costs, all of which is wasting money that could actually be on direct healthcare. Now, for Scotland, the problem is still that our overall budget is set by Westminster. If they start identifying a smaller healthcare budget, which indeed the Conservatives did throughout the 2010s, where it didn't rise at the normal level of health inflation, is you have this decreasing funding. And while the Scottish Government have always put more of their budget into healthcare, and particularly this year, they're still dealing with a limited purse. And that leaves them less money to deal with some of these aspects that, as I said, contribute holistically to health, such as education, local government, police, housing. All of these things would help contribute to health, and the Scottish Government end up scrabbling, trying to maintain the NHS, which is about trying to deal with illness. And it's trying to change that whole narrative round to looking at our citizens holistically and trying to give them the best quality of life from the beginning to the end of their life. And unfortunately, we do not have the freedom to do that. We are always working with one hand tied behind our backs. And that's because Westminster controls the purse strings, controls the rate of poverty and deprivation. And if we can't change that, we won't manage to make Scotland a healthier place to live.
So why is Westminster so wedded to private market involvement in the NHS? One of the reasons could be lobbying and the funding of politicians by vested interests such as American private health firms, especially at election time. The question that should be asked, says Philippa Whitford, is what exactly do these private firms want in return for their investment?
Well, I think, there's a lot of talk about, or in my time, about second jobs and how that was dividing loyalties of MPs. But what we've seen, particularly this year as an election year, is the donations to individual politicians. And whether that's from other countries, from embassies, or particularly from companies, you do have to ask is, what is it they expect in return? And we certainly are aware that there's a significant number of frontbench Labour MPs who've had significant funding from private healthcare companies. And I'm sorry, there has to be a quid pro quo that those companies are expecting in return. And I mean, that's something that I just don't think should be allowed, whether it's at the time of elections or whether it's within a parliamentary phase, because it's meaning that you've got MPs whose loyalties are divided. They're not focusing on what's best for the citizens that they're responsible for.
So what kind of future is our NHS facing if Scotland remains in the UK? Well, almost certainly, the end game of the UK government in England is ever greater private involvement until the NHS, starved of funds to operate properly, is finally fully privatised based on the American health for profit system, where if you can't pay, you are left to fend for yourselves. Can the partially devolved Scottish Government resist the direction of travel in England, let alone set a completely different strategy for our NHS?
Well, the only way that the Scottish Government can actually focus on their priorities, which is holistic health and well-being, is to have all the levers of control for that. And unfortunately, that is only with independence, and there's no getting away from that. As I said, poverty and deprivation drive ill health. So if you want to, plug the hole in the boat instead of just bailing it out, you need to actually be able to do that. But even from the point of view of designing and controlling and funding the health service that you want, you need to be in control of it. And if something is that precious to you, you want to have power over it completely. That means power to welcome people from other countries to come and work in it and supplement our workforce, but also to have the funding to invest in hospitals, in expanding our NHS. In England, the way of tackling the backlog, which frankly has seen all 4 health services on their knees since the pandemic, In England, those patients who've waited longest are being given to private companies to deal with all of the problems that that brings. In Scotland, the approach was actually to build more elective treatment centres like the Golden Jubilee. But then what happens? Westminster cuts the capital funding, and all of those projects are set back by 2 years. So we don't want to be handing more and more money over to private companies who frankly are not in it for the patient's welfare. They're in it for profit. They cherry pick easy operations. They will often even operate on patients where in the NHS it might be felt that wasn't necessary. And there's not the same level of control of who's doing what standard they're working at. It's quite telling that last year the NHS in England had to hand out £84 million in compensation to patients who'd been sent to the private system and had then suffered from serious complications. So the private system, which is about profit, it's about shareholders, it's not about the health and benefit of the public, their motivation is not the same as what we want to see in a health service in Scotland. So in Scotland, we don't want private companies taking over hospitals as we had previously in England. We don't want private companies expanding and replacing the NHS. And we don't want people being driven to take out health insurance. That means we need to control our economy. We need to gain from our amazing resources like green energy, and then be able to invest that in housing, in communities, in education, and in health. Health as in making people have a good quality of life and enjoy health and well-being from a young age, as well as supporting people who have illness through a national health service. And also tackling social care. Social care is the linchpin to improving our NHS. And we can't fix that unless we can bring in the workers, unless we have the funding to put there, and unless we can ensure that people reach older age in good health. And those are things that all add together. If we only look at the National Health Service, thinking of GPs and hospitals, we're looking at it far too narrowly. So we need the Scottish Government to control all of that, but actually to have control of our societies, our communities, and build communities that basically drive forward good health and well-being for everybody who lives here. And that means not just physical and mental health, but social, economic, and environmental well-being. That is what would bring a good quality of life for Scots. And for that, we actually need to be in control of our own future.
The evidence of private sector involvement in other services such as water is a clear warning to what is already happening to the NHS in England.
Well, I think we've got experience literally going back to the 80s that privatising services, particularly vital services for the public, doesn't work to their advantage. I mean, we only need to look at the cartel of energy companies or the disaster of the water companies in England to realise that what happens when you privatise, the shareholders become the priority, and often money is being sucked out in profits, in dividends, or even enormously high salaries to the executives, rather than it being focused on the service that's being delivered. So I've yet to see any of the public sector services that were privatized from Mrs. Thatcher through Blair and onwards, where the public would feel that they get a better service now than they did in the past. And what is always there is that they still are demanding public money to be put in. It's not even as if it's handed over to the private sector and no taxpayer money is required. There's always, whether you're looking at rail franchises or others, there's always this demand for public money. And of course, we've seen, not just in Scotland, but across the UK, the utter disaster of private finance initiatives, which Labour brought in to hide the need for public spending. And of course, local government, schools, hospitals are still paying off often 4 or 5 times the value of the building that was created. And certainly I know from colleagues who work in PFI hospitals the difficulty they have in even getting slight alterations to an office, to a ward or anything. And what we saw in some of the hospitals was a complete failure to understand medical standards. You know, putting in hotel standard air conditioning, not operating theatre standard air conditioning. So, you know, the NHS isn't a business. People are not widgets and you're not selling them. So to me, that is not the approach to take for vital services, whether that's energy or water or health, that people have no choice but to use. Those should be delivered by government, and they should be delivered directly to the population, as that's the most cost-effective way to do it.
Whilst Scotland's devolved administration has so far been able to slow down Westminster's relentless march to a privatised NHS, the big question many families in Scotland need to ask is, can I or my family afford another £400 extra a month, the average cost of health insurance for an individual in the USA? Or, if the worst happens and my family face serious illness, will we face bankruptcy just like millions of Americans do every year? That is the reality for over 25 million Americans who cannot afford health insurance cover. And while some of us may not see the full privatisation of the NHS in our lifetime, our children and grandchildren almost certainly will. That is, unless the people of Scotland conclude that the only way to create a better future for them is through independence. It's the only way that Scotland's NHS can ever hope to be taken off the critical list and saved for future generations. Because simply hoping we can continue to mitigate the problems being caused by disastrous decisions taken in London is not enough. Scotland needs to take a completely different path to Westminster's health for profit plans, a path where patients are the priority, not private shareholders. If you have found this film informative, please like and subscribe to the Scotland channel. Hit the bell icon to be informed about new releases on the Scotland channel. Become a friend of the Scotland channel to support independent Scottish media. See our website thescotlandchannel.tv/friends for details.